and welcome. This is Hands on Health, a podcast all about living your healthiest life on the coast. I'm Alyssa Evans.
And I'm Austin Miller. Today, we're chatting with Kim Thomas from the Financial Services here at Columbia Memorial Hospital. How are you doing today, Kim?
I am doing great. How are you?
We can't complain on our side.
Well, that's good for a Friday.
Yeah. Anyways, we just wanted to chat a little bit about kind of what is the Patient Financial Services? What is it, kind of in a brief overview, that you guys do over there?
So we are sort of like the man behind the curtain, in Wizard of Oz. I have a few departments. We have our billing department, which is the department full of people responsible for making sure that all of our insurance claims get submitted to the insurance companies. And then when the insurance inevitably denies a nice portion of those claims, they then start to harass them for payment. And so we've got the insurance side, and then we have our financial counseling team who focuses on assisting patients with connecting them to financial resources. They do some Medicaid enrollments, so they help them get set up with our Washington and Oregon Medicaid plans. If they do not have insurance, they can also help them identify a marketplace plan. And then we have our authorizations and referrals team. And so those caregivers help patients get referred to the services they need, either in CMH or outside of CMH. And then the authorization caregivers make sure that all of those services that the patients are receiving are authorized with their health plan, so the patient doesn't have any out-of-pocket, or, at least they're informed of any out-of-pocket cost. And then we have our coding department. We have a vendor that helps us with our coding services. So they work all over the country. And those are the people that apply all of the codes to each encounter that a patient receives here that translates that visit to a billable service so that we can collect money for it. I think that about sums it up.
That's a lot. That's really impressive to hear all the different departments within the department.
Yeah.
That's really neat.
Yeah, it's a lot behind the curtain.
Quick follow-up on that. You kind of mentioned the codes. For anyone who might not be familiar with this, what again are those codes? Can you go just a little deeper into what that is?
Sure. So let's just say a typical office visit. So a patient goes in to see their primary care provider, and that visit is everything that the provider renders to the patient is codified by a certified coder. So they're spending time with the patient, they're taking patient's history, they're doing an exam, they're doing an assessment and plan, for example. So the coder translates that to a code that the insurance company recognizes and values for payment. And there's a code for everything that happens in this hospital, whether it's an IV that is placed or, a PET scan that's done, an X-ray. Everything gets translated to a code that then gets placed on a claim. And then it gets submitted to an insurance company or directly to the patient when there is no insurance.
That makes sense. That's really impressive too, because I'm sure there's so many different reasons why people come to the hospital, whether it be for just a routine checkup or something more serious and more intricate, like a surgery. That's really neat to hear that there are so many different codes for everything.
If you think about the typical inpatient stay, let's say the patient is here 2 days, those insurance claims are pages long. There are hundreds of codes for all the services that happen with that patient. Yeah, it's very fascinating, I think.
Yeah, I agree. Do you mind walking us through what the experience might be for a patient who comes to CMH and who works with your department? What would it look like for that patient, maybe going through the different departments of PFS to get taken care of?
So I think for the most part, the most patient-facing positions that we have are really the financial counseling team. So, and they do a lot of connecting with patients, whether the patient is in the emergency department and needs financial assistance, or whether they're admitted in-house. The financial counselors will go over and help the patients, connect them with financial resources available to them, as well as, we have financial counselor in the pavilion. And so the patients come in. We even have patients who come in with bills out that aren't even CMH bills because they don't understand them. So the financial counselors will help them navigate that stressful financial side of healthcare.
Wow, that's incredible. I didn't realize that PFS caregivers even help patients who have worked with other organizations. That's incredibly kind.
It is very unfortunate how confusing the financial side of healthcare has become. I mean, you think about, I just described or alluded to the challenge of the coding piece, but the code sets that are used, there are multiple code sets. So coders and billers and financial counselors, they all have to understand all of these different languages. And then they have to help. I mean, I just always feel so bad for some of our patients. It's just so easy to get lost on that side of things. So I feel like our team's very helpful navigating that world and minimizing or at least reducing the stress that the patients feel.
Yeah, I can imagine. I mean, I know like a very, very surface level about what those codes are, but I couldn't even tell you what any of them mean. It's a whole course, I think, just to learn all those, isn't it?
It really is. And then, every insurance company, they don't all use the same code set. So, and they change the rules frequently. So it's difficult for patients to understand. I hear that all the time that they're so confused. And why does it have to be so hard? And, I don't have all the answers to that. I just can completely relate and empathize. It is hard.
Mm. Well, and you mentioned too that you guys work with the insurance companies, right? You guys are the ones bringing things up in the claims to the insurance companies to make sure they pay out.
Yes.
Can you go in a little more detail about like what it is you guys do with the insurance companies?
For every service, that claim is submitted for, the patients who have insurance. And so the insurance company, on average, kind of the national number right now is that it's 25 to 30% of all claims deny from insurance companies. In my experience, and I've been doing this for quite some time, many of them are erroneous. And the pandemic has definitely had an impact on insurance claim processing. So what the billers do is we receive the denial into our system and we organize them in Cerner. And then the biller follows up with the insurance company to find out why that claim denied. Now, they have tools available to them so that they're hopefully calling, and they are calling with an idea of how they're going to tackle this denial. They've already reviewed the denial information, and it's almost like you're preparing for war because the insurance company doesn't want to give you their money. And throughout the pandemic, I feel like we're back in the 80s almost, where HMOs were first born and everybody was really challenged getting payments. But it has been so much more difficult to get claims paid. And I think, insurance companies have had, they all, most of them sent their workers home. And they did so without, maybe appropriate tools and phone systems and all of that. And then they had also a lot of turnover, just like everyone else in the world right now, right?
Yeah, that's hard.
Our billers are working with people that sometimes don't know how to process claims and they don't know why the claim denied. It's a fun run around trying to get a straight answer. And oftentimes they'll escalate to supervisors. And it's just been a really tough couple of years for that team. And it's the same really with authorizations and referrals because anyone who's intersecting with insurance companies is having a challenge right now.
It's comforting to know that there's at least someone going up to bat for the patients too, because I can imagine if you're going to the hospital already, you're already stressed. And then that financial aspect. In fact, I had the chance to interview a lady not too long ago, and she had cancer, and she was saying that the scariest thing was the finances, not even the cancer itself.
Yeah. Isn't that terrible?
Which I think that says a lot. Yeah.
Yeah. And it's not really even the cost of care. I mean, of course, it's to the patient what they will be financially responsible for. So we do our best to make sure that we've connected them with everything that they are eligible for. But it is even navigating the world with the insurance companies, because I don't mean to demonize the insurance companies. We're all going through it throughout this pandemic, but it is long hold times. I mean, patients are experiencing that too. And they're talking to the same people at their insurance companies that are challenged in their own way. So they're not getting straight answers and direct information. So I think that's where we really try to bridge that gap. And we'll make calls with the patient on the phone to the insurance company to help with that conversation to resolve the issues for the patients.
Are there any tips or suggestions that you have for patients who may end up working with PFS in the future? Are there any things that you would want patients to know that would help improve the experience at all? I know a lot of it is kind of out of your hands working with others, but is there anything on the patient side that could be improved or that you would want them to know?
I mean, I think we have some patients that just require more assistance. And I think that we're always going to see that. We're in a community with more elderly patients than, some areas. And I think that contributes to some of the challenge. I guess my tip would be to be an advocate for yourself and just continue to ask why. So whether you're dealing with the insurance company, I don't feel like you have to push on our team. I think they're so beyond willing to help, but definitely don't give up.
I think that's great advice. And I know a lot of people will get frustrated and they will give up. So it's reassuring to hear that from someone who is an advocate for a lot of our residents here in the county and surrounding counties too. Is there anything that you would like people who are listening to know about patient financial services that we haven't talked about? I know there's a lot of different things we can delve into.
Yeah, I think the one thing that I would introduce that I think some people are aware of now, but we haven't really done much marketing yet as we've really been building our infrastructure to support this. But I think we're at a good place to start to do more of that, is that through the last couple of years, there's been a big emphasis on price transparency. And organizations have been required to publish prices, really focusing on improving communication and providing recognizing patients as consumers, giving them information so that they can make informed decisions about their healthcare. And we've been working very hard on that and we implemented a tool within our system to provide price estimates. So now we're generating estimates on scheduled procedures and sending them through the patient portal. So I would really encourage patients to, if they have not yet created a portal account, to do so, but then to know that anything that you're going to receive at CMH, you can get an estimate of what you will owe for that service. And you can connect with a financial counselor prior to that service to make sure that you have every benefit that you're entitled to cover that balance. I shouldn't say that the balance will be covered. I just mean if there's any additional resources out there like Medicaid or our financial assistance program, which is a very generous program, if the patients qualify, they could have a reduced balance.
Wow, that sounds like a great thing that's coming up on the scene for patient care. I think that's going to be excellent.
Yeah, that's fantastic. I know that will benefit a lot of people to get more familiar with that so they can better understand what they're getting care for and the different aspects of it.
Well, and hopefully to not be, scared of getting care. I know a lot of people will refuse to go to the doctor because they're worried about how much it's going to cost. They don't know. So hopefully that'll help improve the care for a lot of people here.
Yep. And we've been doing them since October, and we've provided over 1,000 estimates, and we continue to expand the areas where we're providing those. So it is exciting, and we've gotten really good feedback.
Well, that's great.
Thank you so much, Kim, for joining us today and for chatting about what the Patient Financial Services does. We really appreciated it and enjoyed having you with us.
Yeah, thanks for having me.
Yeah, of course. Thanks, Kim.
And thank you all for joining us today. This has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital here in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us next time for another episode of Hands on Health.